Living with type 2 diabetes can feel overwhelming, especially when insulin injections become part of your daily routine. But here's something exciting. Research shows that many people can actually eliminate their need for insulin injections. Research suggests that up to 86% of people with type 2 diabetes can stop using insulin when they make the right changes. The key is understanding which methods work best and taking action before the condition progresses too far. People who had type 2 diabetes for even 20 years had reversed the condition. I have had diabetes for more than 30 years, and I am managing with tablets and getting HbA1c values around 6.5%. The good news is that type 2 diabetes isn't always permanent. Unlike type 1 diabetes, which requires lifelong insulin, type 2 diabetes can often be put into remission. This means your blood sugar levels return to normal ranges without needing diabetes medications. But time matters. Research shows that people diagnosed within the first year have a 77% chance of achieving remission when they follow the right approach. The longer you wait, the harder it becomes. Consult your healthcare professional before changing your medication or lifestyle. Number 1. Low-carbohydrate diets. Cutting carbohydrates significantly can help eliminate insulin injections. Low-carb diets work by reducing the amount of glucose entering your bloodstream, which means your body needs less insulin to process it. Studies define low-carb diets as getting less than 26% of your daily calories from carbohydrates. My personal preference would be to use plant-based low-carbohydrate foods, especially all types of beans and legumes. They are cheap. You can store beans for a long time without refrigeration, and they do not cause high cholesterol. Research involving 1,357 people across 23 clinical trials found that those who followed low-carb diets achieved greater rates of type 2 diabetes remission compared to other recommended diets. In real-world practice, a UK clinic using low-carbohydrate advice helped 20% of their entire type 2 diabetes patient population achieve remission. The approach works even better for people with newly diagnosed diabetes. In the first year after diagnosis, 77% of people given low-carbohydrate advice achieved normal blood sugar levels without any diabetes medication. For established diabetes, the success rates were 35% for 1 to 5 years, 31% for 5 to 10 years, and 20% for over 15 years. Number 2. Mediterranean diet approach. The Mediterranean diet offers a sustainable way to improve diabetes control and potentially eliminate insulin needs. This eating pattern focuses on whole grains, fish, vegetables, olive oil, nuts, and legumes, while limiting processed foods and red meat. Studies show the Mediterranean diet can reduce diabetes risk by 19 to 23%. For people already diagnosed, following a Mediterranean diet led to greater reductions in blood sugar levels compared to low-fat diets. One analysis found that the Mediterranean diet reduced hemoglobin A1c levels by 0.47% more than control diets. The pre-DIAB study, involving people at high cardiovascular risk, showed a 30% reduction in type 2 diabetes risk among those following a Mediterranean diet. The diet also promoted weight loss and improved insulin sensitivity, two key factors for eliminating insulin injections. Many people find this approach easier to stick with long-term because it focuses on adding healthy foods rather than restricting entire food groups. Wait, there is more, but do not forget to hit the like button if you think this video is useful. Number 3. Weight loss through calorie restriction. The most powerful method for eliminating insulin injections is significant weight loss. Research reveals a clear connection between how much weight you lose and your chances of stopping insulin. For every pound you lose, your probability of diabetes remission increases by about 2%. When you lose 20 to 29% of your body weight, nearly 50% of people achieve complete diabetes remission. But even losing 30% or more of your body weight gives you almost an 80% chance of complete remission. The Newcastle diet shows this works in real life. People followed a very low-calorie diet of 600 calories per day for 8 weeks. After 3 months, 7 out of 11 people were completely off their diabetes medication. Very low-calorie diets between 800 and 1200 calories have proven effective in multiple studies. The key is working with healthcare professionals to ensure you get proper nutrition while losing weight safely. Most successful people lost 30 pounds or more and hadn't had diabetes for very long. Number 4, intermittent fasting. Intermittent fasting offers another proven path to eliminate insulin injections. This approach doesn't restrict what you eat, but when you eat. The most popular method is the 16-to-8 approach, where you eat all your meals within an 8-hour window and fast for 16 hours. 3 patients at an intensive dietary management clinic eliminated their insulin needs completely using therapeutic fasting. All 3 succeeded within a month, and 1 person stopped insulin in just 5 days. The 5-to-2 method also works well. You eat normally 5 days a week and restrict calories to 500 to 600 calories on 2 non-consecutive days. Research on 405 adults with early type 2 diabetes found that a 5-to-2 intermittent fasting approach with meal replacements worked better than standard diabetes medications for blood sugar control. People following intermittent fasting tend to consume fewer calories naturally during their eating windows, which leads to weight loss and improved insulin sensitivity. Number 5, plant-based nutrition. Plant-based diets show remarkable results for reversing type 2 diabetes and eliminating insulin needs. These diets focus on whole plant foods like vegetables, fruits, legumes, whole grains, nuts, and seeds, while eliminating or drastically reducing animal products. Research involving 99 people with type 2 diabetes compared a low-fat vegan diet to standard Diabetes Association guidelines. After 22 weeks, 43% of people on the plant-based diet reduced their diabetes medication, compared to only 26% in the standard group. Even more impressive, lean men with type 2 diabetes who were taking insulin were placed on a high-carbohydrate, high-fiber plant-based diet. Half were able to stop insulin completely, and the rest significantly reduced their insulin doses. The average insulin dose dropped from 26 units to 11 units on the plant-based diet. These results happened even when body weights stayed stable, proving that the diet itself, not just weight loss, reversed insulin resistance. Plant-based diets work by reducing inflammation, improving insulin sensitivity, and providing high fiber that helps control blood sugar spikes. Number 6, structured exercise programs. Regular exercise can dramatically reduce insulin needs and sometimes eliminate them entirely. But watch the video in the above link. Why is blood sugar dangerously low? Diabetes medications that can cause hypoglycemia. A 12-week structured exercise program reduced insulin resistance by over 30% in people with type 2 diabetes. Exercise works by making your muscle cells more sensitive to insulin and helping them use glucose more effectively. The best results come from combining aerobic exercise with resistance training. Aerobic exercise alone can reduce hemoglobin A1C by 0.6 to 0.8%, which represents clinically significant improvement. Resistance training adds additional benefits by building muscle mass, which acts like a glucose storage system in your body. Research shows that 150 minutes of moderate exercise per week, spread across at least 3 days, provides substantial benefits. But even shorter sessions help. Breaking up sitting time every 30 minutes with just a few minutes of light activity, or simple exercises like squats, can improve blood sugar control. People with type 1 diabetes have shown 6 to 18% reductions in daily insulin requirements through regular exercise training. While type 2 diabetes typically requires less insulin to begin with, the relative improvements can be even more dramatic, sometimes leading to complete elimination of insulin needs. Number 7, bariatric surgery. For people with severe obesity and type 2 diabetes, bariatric surgery offers the most dramatic results for eliminating insulin injections. Between 60 to 80% of people with type 2 diabetes experience significant improvement in their diabetes within a year of surgery. Gastric bypass surgery shows the best results, with nearly 80% of patients achieving diabetes remission. Even sleeve gastrectomy, which removes part of the stomach, leads to diabetes remission in over 60% of patients. The most dramatic procedure, duodenal switch, achieves remission rates above 85%. What makes bariatric surgery unique is that diabetes improvement often happens within days to weeks after surgery, even before significant weight loss occurs. This suggests the surgery changes how your intestines handle glucose and insulin production, not just through weight loss alone. Research shows that even if people regain some weight after surgery, those who had gastric bypass maintain better diabetes control compared to sleeve gastrectomy patients. A 5-year follow-up found that people who lost at least 15 kilograms through bariatric surgery had a 70% chance of sustained diabetes remission. The timing matters most when you're trying to eliminate insulin injections. People diagnosed with diabetes less than 10 years ago have the best chance of complete success with these methods. But people who had diabetes for longer than that still can benefit by eliminating damage to other organs and lower dose of medications. These approaches can still help you reduce or eliminate insulin and other medication needs. Research consistently shows that combining several methods out of the 7 works better than using just one approach. Weight loss remains the foundation, but adding exercise, improving your diet, and working with healthcare professionals creates the best chance of success. The key is starting as soon as possible and staying consistent with whichever method you choose. Ideas for you to explore. These 7 evidence-based methods could form the foundation for a comprehensive idea about diabetes reversal. The clear statistics and real-world success stories provide compelling material. Understand your options for potentially eliminating insulin injections through lifestyle interventions. Please click the like button and subscribe if you think this video is useful. On the screen, you see an essential video for you. Thanks very much for watching this video. References are in the comments and description sections. See you in the next video.